what are the things that need to be done and what are the things that need not be done or should not be done. And I think that's extremely important. We should know what should not be done, right? So I think the first and uh, most important thing is to ensure the safety of the individual having seizures, right? So quite often it's a tonic-clonic seizure, but it may not be a tonic-clonic seizure. And the problem with tonic-clonic seizures is that people can injure themselves, they can fall, they can have fractures, they can have injuries, they can have dislocations. A whole lot of things can happen. And then remember that these seizures are a risk um, unfortunately true, for a risk for the person dying, right? So there is something known as SUDEP, sudden unexpected death in epilepsy, or there can be several other reasons. The person might be swimming and or maybe near a pool of water, or might be standing at a height and has a seizure and he falls, or might actually be driving and he has his first seizure at that point of time. So there is a tremendous risk to life during these seizures, right? So it's important to know, and it's important not just for people with epilepsy to know. It's not just important for the carers of people with epilepsy to know. It's not just important for everyone who is somehow connected to someone with epilepsy to know. It's for the general public. So you see a seizure on the road, right? You don't know the person, but what do you do at that time, right? Some people might put something into the mouth. Some people might put a spoon in the mouth. Some people might put some keys in their hands. Some people might gag them, right? Some people might give water to them during the seizure, right? Which these are things not to be done, right? But then again, coming back by what is to be done, and let's take the case of a generalized tonic-clonic seizure, right? So the first thing is to ensure safety. If the person is wearing specs, take out these specs. It should not be anything around which can injure them or harm the people, right? There's a fire, it's near a fireplace, get him away from the fireplace, right? If there is a body of water and there is a chance that he might fall or it's a height, get him to a safe place, right? So the first thing is to ensure the safety of the person, right? Now, one common misconception is when a person is having a tonic-clonic phase, the initial reaction should be to shift the patient to one side, right? Or turn the patient to one side. Now, what happens, and there are some very good studies, this, when people dislocate their shoulders during seizures, during generalized tonic-clonic seizures, usually the dislocated shoulder is the one which is below, right? On the side to which the person has been turned. So turning the patient during the tonic phase, or perhaps sometimes even during the clonic phase, very early, can actually increase the chances of shoulder dislocation, particularly on the side which is below or the side to which the person has been turned. So for the initial period, let the patient lie on his back, right? But as the seizure starts abating, it's good to turn the patient to one side. So that will ensure that the tongue does not fall back. If there is any frothing or accumulation of saliva or secretions in the mouth, they all come out as a result. You can pat him gently on the back. That might actually encourage the patient. Patient is, of course, unconscious, but at least some of the secretions to come out, right? And be with the patient. It's extremely important to be with the individual as long as he's having seizures. People are crowding, just reassure them, nothing, fine. We're taking care of the patient, right? We're taking care of the seizure, right? And also extremely important, and this is something which is often missed. And I often tell all the family members who accompany people with seizures is to time the seizures, right? It's extremely important to time seizures, right? There is a lot of confusion at that time. People panic. So this often does not happen. But if you're not panicking, if you are in command of the situation, it really helps. And then if you are in command of the situation, just time the seizure. What time did it begin? What time did it end? As I said, most tonic-clonic seizures last for less than 1 minute. And if a seizure lasts for more than 5 minutes, it is called as status epilepticus. The patient needs to be transported immediately to the emergency, nearest hospital emergency service, and intravenous drugs need to be given to stop the seizure, right? So, which is why it is extremely important to time the seizure. Most often it is not done. I completely understand it's a panic situation. People think that it is the end of the world. The witnesses think it is the end of the world. But if you can time, it would be great. It gives a lot of information to the treating physician, right? What time did the seizure begin? When you get the patient to the hospital, it gives a huge amount of information to the emergency doctor there, right? So another thing that can be done is we all have cell phones, right? And all cell phones, smartphones have cameras, videos, right? So it is usually a great idea to make a video of the seizure, right? Because once the seizure is over, you would seek medical advice, right? And therefore, if you have a video recorded of the seizure and you show it to your doctor or physician or neurologist or epileptologist, it would give him a lot information about what kind of seizure it was, right? Uh, but if you're alone, if you're panicking, then please forget the video. Safety of the individual who's having seizures is the most important thing, right? So usually making a video is generally not possible on the first occasion, right? But then as people get used to it, carers and family members get used to it, and if there are more than two people witnessing the seizure, two family members, then one of them can focus on safety of the individual and the other person can do the video, right? But if you're making a video, I have three important recommendations for that. The first is try your best. It may or may not be possible. Try your best to make the video right from the beginning till the end, because the beginning part of the seizure is the most important. It gives the greatest amount of information regarding which part of the brain did the seizure begin from, right? Okay. So beginning to end, right? Please go back about 4 to 5 feet away from the individual who's having seizures and then make the video, right? Because if you get too close, we want to know what's happening to the entire body. What are the kind of movements that are happening to the entire body? So if you do a close up, right, go just near the face of the individual who's having a seizure, you might not get that kind of information. So please go back about 4 to 5 feet and then make the video so we get to know what kind of movements are taking place in the limbs, in the face, in the body. So that gives us more information, right? And then it should be done in a well-lighted room. So it's middle of the night. So it's a good idea to switch on the light and then record the video, because a dark room recording may or may not provide enough information. So I think these are some of the things that need to be done. What does not need to be done is also extremely important, as Dr. Develina clearly emphasized. Do not put anything into the mouth, right? Some people put a spoon, and I've had an instance where the spoon actually broke into two and one half went inside. Some people will put their fingers into the mouth of the person having seizures. Their fingers get bitten, right? Don't do that. I mean, the idea is completely understand you're trying to prevent a tongue bite, right? But If it has to happen, it will happen. And if it's not a tongue bite, it might be your fingers, right? So don't put anything in the mouth, right? Do not give any water to the patient during or immediately after the seizure, right? Because many people after the seizure might actually throw up, right? They get sick, they might vomit, right? So if you give water, then the chances of throwing up will actually increase, right? They might aspirate, all this water might go into their chest, right? And then they will have a pneumonia. So that's also not a good idea. Don't give anything by mouth, right? Okay. Do not well, many people would put some keys into the hand. It's pretty much not required, right? Some people might make people smell shoes. It has no basis, right? It's a big myth that smelling shoes can abort seizures, right? So it has no basis. Another thing important to emphasize is that most seizures would stop on their own, right? Now, therefore, it's not necessary that you have to rush the patient to the hospital, right? Someone who's having seizures, most seizures will stop within 1 minute, and the person will recover consciousness in about 10 minutes. The first time someone is having seizures, it's a pregnant woman with seizures. And most important, if the seizure and the seizure is lasting for more than 10 minutes, more than 10 minutes, sorry, did I say 10 minutes? No, more than 5 minutes, right? That is status epilepticus. You need to take that patient to the hospital emergency immediately. Otherwise, most seizures would stop on their own, less than 1 minute, recover consciousness in 10 minutes, and therefore it's not necessary to rush the individual to the hospital. Every person with seizure need not be rushed to the emergency. So these are some of the things that should not be done. That's extremely important.